No one chooses debilitating pain, nor do you choose the experience that comes along with it. The daily struggle, the life-altering pain, the sitting idle waiting for specialists for months or even years, and the frustration of doing all the things without any change to the pain you feel. While you did not choose this pain, you can choose to get back in the driver's seat once and for all. Welcome to the Chronic Pain Experience podcast. I am your host and chronic pain recovery coach, Dina Chopoulos. Tune in as I explore the complexities of chronic pain recovery, the root cause of the pain you feel, and tools and techniques to help you on your way to a life well lived naturally. In the relentless pursuit of relief from chronic pain, fascia, a vast connective tissue network, often goes unnoticed. Yet, symptoms like deep aches, stiffness, and tender, sensitive areas may all stem from fascial dysfunction. By understanding how pain works and how our biology responds to it, we can uncover strategies to shift pain patterns and foster healing. In this episode, we explore the profound connection between fascia and chronic pain, while sharing practical techniques to improve fascial health at home. Tune in to learn how understanding your body can be the first step toward reclaiming your life from pain. Well, hello and welcome to the Chronic Pain Experience podcast. My name is Dina and I am your chronic pain recovery coach. Today, we're going to be diving into the fascinating part of our body, which we don't talk enough about, and that is our fascia. And today, I've invited in a fascial specialist, which we're going to talk to Nellen more about this, but Nellen Krull is the co-owner and clinic director of Myofascial Release Mississauga. Nellen completed her Master's of Science in Physical Therapy at the University of Toronto in 2011. Upon graduating, she was attracted to the fast-paced and acute nature of patients in the hospital setting. For 6 years, Nellen worked as a physiotherapist in the Credit Valley Hospital in various areas including surgery, medicine, pediatrics, obstetrics, palliative care, oncology, and emergency. Nellen is currently training in myofascial release, the John Barnes approach, and is also providing educational workshops to her clients. Her goal is to help people suffering with chronic disease and chronic pain improve their quality of life through education, lifestyle changes, and physiotherapy. And I love talking to physiotherapists because you guys are always on the leading edge of what's going on when it comes to chronic illness and chronic pain. Nellen, thank you so much for being here.
Thank you so much for having me. I'm excited to chat more.
Yeah, we could probably chat for hours because there is to talk about. We do share a lot of these common approaches, which I love.
Mm-hmm.
So, all right. When I was in university all those years ago, and we're talking like in the 90s, we didn't know much about fascia at all. And came to working on the cadavers, really, it was just tossed aside, which,
totally.
Right? And I find it fascinating. So before we get into what fascia actually is, when do you feel like things really started to change for us, our understanding around fascia?
I want to say it was like in the last decade or so, because even when I was doing my physical therapy training, same thing. We did cadaver dissection and the fascia was not spoken about it in my training. So that was, like you said, I graduated in 2011. There was very little to no education around fascia. So all of it was done, post-grad education. So yeah, I think that there are other areas of the world that are a little bit more advanced. I've been talking about it more, and I think that it's now coming up to Canada finally. So it's become a little bit more of a trendy word or hot topic, I guess.
For sure. But it's good. I feel like anytime there's new research when it comes to chronic illness, chronic pain, and just health in general, it tends to be front and center for a little while. Anyway, I'd love for you to maybe just explain to our listeners, what is fascia? What does it look like? What does it do for us? How important is this entity inside our bodies that we don't know much about?
Of course, yes. Fascia, in my opinion, is the most important organ, and I don't know if you'd call it an organ, but most important structure.
Yeah.
And the reason for that is because it touches all other structures in the body. and it provides support and allows for communication between those structures. So if you want to imagine what the fascia is like in your body, a lot of people tend to think of it as, yeah, that sort of white sheath that you discard, if you're thinking about cooking like, raw chicken. If you take off that sort of white sheath, people think that's fascia, sort of like a saran wrap of, muscles and etc.
Mhm.
But it's actually more of a three-dimensional web. And so it does support, the outer casing of all muscles, but it also supports the intracellular makeup of all the tissues. So not just muscles, but bone, nerves, blood vessels, vital organs, your brain, and of course skin. And so when there is restriction in the fascia, think of it a bit like bubblegum in hair.
Ah,
It's that complex. So this three-dimensional web gets sort of stuck down and can't glide and move freely as it would normally. And that's when we start to get, crushing pressure on pain-sensitive structures. We get limited range of motion. And it can also create like weird symptoms that people don't always attribute to the need for physiotherapy, because oftentimes when things don't follow like a usual musculoskeletal pattern, it's confusing for a lot of people.
yeah.
But if you understand that the fascia touches everything, if you have restrictions in your, let's say, the fascia that supports your digestive system, that can create
Mhm.
symptoms that might behave like something like IBS, right? Which you wouldn't normally think of physical therapy for, right?
Right. Yeah.
Yeah.
Right. I feel like it's just this natural progression that we're on, thankfully, around just research into how connected things really are. I
Hmm.
think that's a
Hmm.
beautiful part about fascia is it's a connective tissue. And so
Hmm.
I think we're starting to really appreciate how vast its influence really is. And I think
Hmm.
that's why this conversation is so important because for our
Hmm.
listeners, just like you said, the whole IBS portion,
Hmm.
I wouldn't even thought about that. And I've been in
Yeah.
for a long time. So good point. We talked a little bit about restrictions.
Hmm.
We're going to touch a little bit more on sort of the biological aspect first before we
Hmm.
dive into other aspects. But biologically speaking, how would someone know that they have a fascial issue in the first place?
That's a good question. So for most people, it presents as pain.
Mhm.
But for us, when we're assessing a client, we don't just look for areas of pain, but you can also do a scan of your body to look for areas that feel hot, that feel tender, that feel even vibratory. Those are areas where your body is expending too much energy unnecessarily trying to heal something. And it's not getting where it needs to go. And so it's like letting off heat and creating all these different sensations. And then, of course, if you've got limited range of motion that wasn't there before, or what people consider muscular pain, those are usually good indications that there's a fascial restriction hanging out somewhere there. But it ends up becoming a process of it doesn't fit a musculoskeletal pattern. A patient has gone through all the scans. Their doctor tells them everything's normal, all the
Mhm.
scans are completely normal, and there's nothing, quote unquote, wrong with them.
Right. Yeah.
And that's when we usually see them too in our office, is when they've sort of come to the end of their rope and they're like, I don't know what to do now. So the answer usually does lie in their fascia.
Yeah. Okay. I do agree. I do think that it's often at such a deeper level. And unfortunately, I think both you and I discover this that we are often the last case resort, right? When they've tried everything else. And that's partially where this frustration comes from, for sure.
Yes. Hmm.
A trial and error. Okay, so I think this one might be more for me than for our listeners, or maybe not, but
Hmm.
I am really curious. There is so much chatter in the industry around trigger points,
Yeah.
especially around fascia.
Hmm.
We used to call them knots. I know
Hmm.
they're not really calling that anymore. What is it for our listeners? When they
Hmm.
do have a painful sensation,
Hmm.
what's actually, and I know there's probably a large list of things going on, but what
Yeah.
typically is going on in the fascia when there is that sort of feeling of a knot?
Yeah. So at the level of the fascia, what's happening is that three-dimensional web is being stuck down. So if you go, remember back to the bubblegum analogy, our fascia, it lives in the interstitial fluid. The interstitial fluid, so the fluid that surrounds every single cell. And what happens is when we experience injury or trauma or even can come about through habitual patterns, that fluid that the fascia lives in becomes more gel-like, more sticky. And that's what creates that sort of bubblegum in hair sort of analogy.
Mhm.
And so what's happening there is because the fascia is restricted, it's creating pressure on all the structures surrounding it. So now let's say we're talking about muscle specifically, because that's where sort of people think about trigger points. Oftentimes people think that it's just a spasm or contraction of the muscle that needs to be lengthened. And that may be true, but what's also happening is the fascia is holding it in that position. And so it really doesn't matter how much you lengthen the muscle, if you don't also release that fascial restriction, it won't change the way that it feels. It may change it temporarily if you do some stretches, but then the fascia will just sort of pull things right back to where they were. So the key is trying to get that ground substance, that sticky fluid that the fascia lives in, to go back to a more liquid-like state. And the way that that's achieved is through low load, prolonged pressure, or stretch.
Okay. And that's excellent. Thank you. That was really, really, I'm really I mean, we know this as practitioners,
Mhm.
but I think for our listeners, it's a really important thing to begin to change our sort of our beliefs around pain, or at
Mhm.
least we're
Mhm.
trying to, change how we think about pain.
Mhm.
We know that our neuroimmune system is a learning system. And
Mhm.
so how much of a learning system too is fascia?
Well, so fascia is it's more of an absorbing system, if that makes sense. It's a little bit more reactionary. So our fascia, generally speaking, is responsible for the biotensegrity of our daily life. And so every time we take a step or walk down a stair or whatever, our fascia is the thing that's absorbing and distributing that force throughout the body. Um, it because the fascia itself is it is the structure of a single filament is more like a hollow tube,
Okay.
water filled. It actually also acts as a communication stream for the body on top of the nervous system. And there is a lot of evidence to show that's emerging anyway,
Mhm.
that this is in fact faster than the nervous system. And
Yeah.
so a lot of scientists are sort of looking at the idea that um, the things that are communicated through the fascia, they're not conscious, right? Because it doesn't happen through the nervous system. It's sort of your body's communication system. And so, for example, when we experience trauma, a lot of times we sort of, I guess the term would be like blackout, or or the people just sort of like remove themselves,
Right.
mentally from where they are, but the body's still there,
Right.
right? And so that communication that of that trauma happens through the fascial system. And so in that sense, it can be what some people believe, and I've seen in our practice, sort of the emotional container of
Mhm.
memory. Um, and that's why, people talk a lot about trauma being stored in the body. A lot of people like talk about the hips, things like that. So
Aha.
it's sort of an absorbing system.
Okay, no, that's fascinating. And I love that.
Mhm.
I love that. So when it comes to that communication breakdown that we see with chronic pain,
Mhm.
because often it is a communication problem, but also sort of a storage problem.
Mhm. Mhm.
So what does it take for
Mhm.
fascia to become less communicative? Or what sort of things are you seeing the fascia doing when
Mhm.
the communication system is breaking down?
Yeah, so when the fascial restrictions happen, there's no communication happening in or out, right? It's sort of like a dead zone in that sense.
Yeah.
And so just because that the fluid through the hollow tubules can't move the way it is because it's being restricted by that really sticky gel-like fluid. And so um, oftentimes what happens, how that presents in people is that they dissociate from that part of their body.
Right.
Mhm.
Oh, okay. This is getting juicy.
Yeah.
this is a lovely segue into the psychological, emotional part of pain. So
Mhm,
you touched
mhm,
on beautifully how, our communication system is affected by the sticky state that this fascia
mhm,
gets into. And again, I love that you brought up the dissociation part because a lot of the work we have to do through recovery is
mhm,
helping to pull the two together and to help those communication systems work together.
mhm,
So I'm assuming that biologically, treatments that you can do to
mhm,
help that communication system work better.
mhm.
How do you guys do that work? What does that work look like?
Yeah, so our treatment is fully hands-on, and we are finding those areas of restriction in the body, and we apply gentle pressure or stretch to that area. So if you imagine, let's say the restriction is in the IT band. That's a good one that people
Yes.
like to sort of go to, because the IT band is basically just a bunch of thickened fascia. Let's say you have a restriction there. We are going to, likely lying on your side, put our hands on the area of restriction, just surrounding it, and then apply that gentle pressure. So the key here is that we need to meet the tissue where it's at.
Mhm.
If we put too much force into it, trying to like really get it to go because we have limited time or what have you, the body will brace. And because the fascia is capable of exerting up to 2,000 pounds per square inch of force on the body, if you try to put some force in, it's just going to push right back.
Ah,
So you have to wait. It's a bit of it's technical, but it's also very mindful in the sense that like me putting my hands on someone's body, the first step is that person's body needs to give me permission to keep going, right? So they need to feel safe and comfortable enough for me to keep going. Then sinking into the tissue just till we feel that first barrier of tension. And then we hold that for a minimum of 5 to 10 minutes. And it takes that long for that gram substance, that sticky substance, to start to become more liquid.
wow.
And in the patient and under our hands, it feels sort of like butter melting in a pan.
Great.
So there'll be this sort of like very slight, uh, almost hardly noticeable movement between the hands, and then the patient will feel a difference. And then we work wherever else we need to go, wherever they're feeling symptomatic, because oftentimes first place where they feel pain is not where the first restriction happened.
Right. That's a whole other
Hmm.
conversation, isn't it?
Yeah.
Okay, so just for those listeners who, I do lean somewhat heavily into, and when I say heavily, I just rely on certain techniques that I can do at home.
Hmm.
In your professional opinion, how effective are things like rolling on tennis balls? And if so, if it is effective, what sort of things should our listeners be looking for, tuning into when they do
Yeah.
it?
Self-care is a huge piece of what we do, so I'm glad you brought that up. Tools are invaluable because if you're not a trained myofascial release therapist, you're going to need some help.
Yes. Yep.
You don't have four hands. So, um, when I suggest treatment for myofascial restriction, the tools that we recommend are usually a little softer. So that we don't get that bracing reaction from the body.
Right.
As you go through treatment and your body understands that it's safe, you can start to use harder implements if you need them. But we give one to our clients. It's a myofascial ball. We sort of give it to every client, sort of like dentists do with toothbrushes,
Yes.
because we want them to use it every day.
Yes. Yes.
It's about 4 inches in diameter, air-filled rubber ball.
Okay.
And because it's air filled, it allows for a little bit more of that softening in the tissue, sinking in,
Yeah.
where your body doesn't feel like it needs to brace so much. And then the key with that is instead of rolling around on it,
Mhm.
keeping it in one spot and using gravity to help you. So usually what we say is just put the ball between you and the floor wherever you feel pain and just lay there.
It's awesome. I mean, really,
Yeah,
the
it
path that
makes things
works.
easy. Yes, and same for things like foam rollers. We usually recommend a softer density foam roller. And then you can work your way up if you need it. Some people don't need it. And again, not rolling around, finding that area of tension or tightness wherever you think there may be restriction, and just sort of letting your body sink into it again, using gravity to help you.
Lovely. Okay. one more thing around the whole biological piece, and I promise we'll move on because
Okay.
so many questions. But a lot of the work that I do is working with the sensitized nervous system, as I know
Mm,
you do too. So
hmm
how impactful is sensitization to our fascia, and what does it look like? How does it respond to sensitization?
Yeah, pretty much every single one of our clients that comes in, it's the same situation. So that the sensitization of the nervous system, it the way that it interacts with the fascia is that because mindset is so important and our minds are so vital to like how we feel in our bodies and how our bodies respond to things. When people start therapy, um, even a little bit of pressure or a little bit of release can feel like super intense.
Right, right.
And then there's also it really does kick in that sort of fight flight response of like, whoa, this doesn't feel safe. And oftentimes, again, it's because they haven't really consciously connected to that part of their body for so long that it's sort of like, whoa, I don't like this. And so for someone who's highly sensitized, they may find initially that there's quite a hump in terms of like getting control of their mind, to remind them that they are safe and everything is okay. Because they're just in their living room on their yoga mat, nothing bad is happening to them, right? Because it can hinder people sometimes when they get too caught up in it. So yeah, it's a little bit of that education and learning around how to get around
Right.
these things that will trigger that fight or flight response.
It's the upfront work around
Hmm
just creating that sense of safety and knowing
hmm
that what you're doing is actually really regenerating, really
Yes.
helpful.
hmm
Great. Emotionally speaking,
hmm
we just touched on it earlier about how powerful emotions are on the body, and that fascia really is one of those containment vessels. So, how do the emotions really impact the fascia, but also other way around? How does fascia then impact our emotions?
hmm So, when we experience trauma, a lot of people think of that as like a physical trauma,
Mhm.
but for basically everyone who's lived a
Right.
life,
Yes.
um, there are many emotional traumas that come up in life, like, the passing of a loved one or, what have you. And those things, because they become stored in the fascia, can manifest as physical restrictions as well. And so for someone who wouldn't know to look there, in terms of past medical history, they might be missing a key piece, in terms of what started this in the first place. Because if we can't allow the body to connect with that, not just physically, but emotionally, then we aren't going to get that real, true release and healing that we want. And so that's oftentimes where, sending a patient to a coach or a psychologist or whoever who can help them connect with that
Yes.
can, sort of really complement this therapy. So, and then at that same time, when we are releasing the fascia in treatment, we do tend to also allow those emotions to release as well. So there's a decent amount of crying that happens in
Yeah,
our
oh, I
office.
bet. I bet. Well, that just shows again beautifully how connected they really are, and how much of it happens at a subconscious level,
hmm
or at least not a conscious level, where they just come about. And I think you guys, with being hands-on, are really building that awareness beautifully.
hmm
Yeah,
Yeah, it's important to connect the two because a lot of people compartmentalize, my emotions are up here. My
right,
body is down here. And when I
right.
have pain, that's obviously down here, right? But they're so connected and I think people take that for granted sometimes.
Absolutely. Yeah. But I think bit by bit, and really this is all relatively new. I mean, just like we talked about
Hmm
right off the bat, this research coming out around fascia and its importance is really only 10 years young.
Yeah.
And any sort of information around how pain works and the research around pain is about 20. So we
Yeah.
really are in the early days and learning still
hmm
so much about how these things influence each other. But what an exciting time. I mean,
hmm
we now know so much more and we can help people so much more effectively. Right. Nellen, is there anything else we may have missed that you think is really important for us to sort of touch on?
Hmm. No, I feel like that's maybe the most important thing that I'd love to share with people with when it comes to pain. is that, that our typical process of, noticing pain and then going to see our doctor and then getting the referral and this and that. Um, it's so focused on structural. And I just would love, you know, not just patients or potential patients who are going through this, um, but also the healthcare providers who are on the front lines, like myself, like other rehab professionals, that they take some time to do some learning on the psychological or mental or emotional aspect of pain because it's not it in school all we really get taught about is like the after effects. So once someone already has pain,
Yes.
now what are the psychosocial issues?
Right.
But if you work backwards,
Mhm.
there's a lot of things that are contributing to where the pain started in the first place. So that's
Absolutely.
something that I wanted to highlight for sure.
Right. Great point. And really, I mean, oftentimes when I'm talking to clients, they feel like, up front, like you're trying to change them completely as a human. It's like, no,
Mm.
you're gonna come out stronger out of all
Hmm.
this, truly, right? With the amount of discovery that you
Hmm.
have, not only about your fascia, but also how your mind impacts your fascia.
Hmm.
One last note, and I'm sorry, just so that I'm
Hmm.
wrapping this up with the whole biopsychosocial model, is
Yes.
what about the social impact? I know that
Hmm.
might be sometimes difficult to tie in with
Hmm.
fascia, but
Hmm.
any words of advice around, we know how important our social aspect is. We are social beings, but
Hmm.
how does the fascia slide into that part of the equation?
Yeah, I mean the thing about us as humans is, yeah, we need to connect with other people, and our fascia is connective tissue.
Yeah.
And so I really like it's just the perfect sort of categorization for it because when our bodies feel good, when we feel good, our fascia feels good. And a lot of times that is through connection. And particularly in the world of chronic pain, there is a lot of stigmatization, a lot of disbelief,
Uh-huh.
various things. And so finding a community where you can express yourself, without being judged, where people understand you is vitally important.
Right, absolutely. I agree. And that's why sometimes coming away from Facebook, like it is a community. I know you as a professional will see this as well. Our
Mhm.
Facebook communities are great for feeling like you're not alone in this
Mhm.
process. However, it's just that repetitiveness reminder of how difficult life is with chronic pain. And so, anyway, on a whole other note, Nellen, thank you
Yes.
so much for being here. If people want to reach out to you, including my husband, which I will get it, reach out to you, how can they get a hold of you?
Yeah, for sure. So they can look us up on Instagram or Facebook or just Google. It's all at myofascial Mississauga. And or myofascial Canada if Mississauga is a tricky word for you to
Yeah, yeah.
spell. And online we have tons of resources where you can find us locally. You can find us. We do participate in retreats on occasion, so you can find us maybe closer to where you live. And then, of course, we have an online course offering that teaches you all of the DIY self MFR tricks that we use with the myofascial balls, etc., to get that pain relief at home. And so that's all available on our website.
Fantastic. I have checked it out. It's awesome. It's a great
Great.
resource. So thank you so much, Nellen. I really appreciate you being here. And of course, I love your approach. So thank you.
Thank you.
To all our listeners of the Chronic Pain Experience podcast, a really big thank you for tuning in. And a really big thank you for all the downloads and all the amazing comments coming in. We are continuing to do the good work. Now, if you are curious and if you think you gained something from this podcast, please be sure to rate our podcast, to share it with anybody who might need it. And the next most important step is to make sure you download our free guide on how to get a better night healing sleep with chronic pain. Thank you as always for tuning in, and I'll see you on the next episode.